Welcome to This Just In, the show bringing you the latest advancements in healthcare, strategy, innovation, and public policy. And now, for the fastest voice in healthcare, here's your host, Justin Barnes.
Hello, everyone, and welcome to the special edition of This Just In Radio. I'm your host, Justin Barnes. Today, we're broadcasting live from Tampa, Florida, and the Moffitt Cancer Center. We were graciously invited to join the CancerX leadership meeting and have several of their leaders joining the show to launch our new Cancer Innovation Series. Many thanks to my good friends, Dr. Kamal Jethwani and Dr. Manish Parikh, for the hospitality in making this on-site location series happen. This Cancer Innovation Series was initially derived from a conversation last October at the health conference in Las Vegas, where I became very optimistic about the strides in cancer care, innovation, and patient outcomes. As we were outlining these episodes, it became even more obvious why we need to tell these encouraging stories about innovation, survivorship, and curing cancer. I hope all of you find these episodes as enlightening and encouraging as me, and I expect to host a follow-on series later this spring, so stay tuned. From your perspective, what recent advances in cancer innovation are you most encouraged by, and why do you believe they're meaningful?
Cancer, there's a lot of money being spent on cancer innovation, right? And so if you think about diagnostics, therapeutics, think about the genetic testing that's coming up, there's a lot that's allowing us now to treat cancer as close to N of 1 as possible, right? We're getting so much data, so much information about the cancer itself and about how that cancer affects the human being that we're able to sort of treat every patient almost uniquely, right? And that's really powerful because now we're making sure that patients are being taken care of at that level. But what excites me really the most is that we now, through the emergence of AI and digital, have an opportunity to actually make treatments that are available for patients reach them, right? Mm-hmm. Despite the advances that we've seen in precision medicine and despite the advances we've seen in the number of molecules we're coming out with, a lot of patients that are being treated in this country, especially in the community centers, don't actually have access to the best possible that's available to them, right? But we can change that with digital and AI, and I'm really excited about making sure that every single patient gets access to every single innovation that there is that can benefit them and that can basically cure them.
And so when we say we, obviously speaking from CancerX, but also what you're doing here at Moffitt Cancer Center.
At Moffitt, exactly, yeah. Moffitt has one of the largest teams that is working on this problem. We have one of the largest data sets in cancer centers. We have spent the last 20 years collating this data, and we've spent a lot of time creating a team that's going to be thinking about how to quantify it and how to think about quantitative sciences. We're the only cancer center in the country that has an actual department of machine learning and AI and mathematical oncology. And so we're really thinking about this from all these different directions and bringing the best of what AI and math has to offer to the front lines of the clinic, right? So we're actually treating patients this way already. That is not happening anywhere else.
I love it. That's why I'm very excited to have the radio show be here for the next couple of days. So what are you currently working on that you're most excited about? And then how do you connect that to patient care and outcomes?
Yeah. Let me start with the problem we're solving, right? Medical knowledge today doubles every 73 days. Right. So just think about that. That's a huge amount of volume we're creating. The impact that has on cancer is that our cancer guidelines are updating very, very frequently, as many as 241 times last year by NCCN. If you take a specific example in breast, that's about 54 times a year. That's once a week. So just imagine as yourself, as a general oncologist, practicing in the community where you have 18 different types of cancers that you're potentially seeing, and everyone has guidelines updating somewhere between once a week to once a month. How do you keep up? How do you keep up? You don't keep up. Yeah. And what's the impact of you not keeping up? The impact is that these patients basically get treatment that is 6 to 9 guidelines behind, right? Wow. That is, and about 50% patients today, we know this for a fact, do not get guideline-concordant treatment when they go and get treatment in the US, right? That is a significantly worse clinical outcome for them. Literally, the difference could be between life and death, depending on where you go to be seen.
Wow.
Right? That is a problem. Now, if you think about the solution to this problem, we can't just do more with what we have today. We can't just expect oncologists to keep up. We can't just expect them to do more CMEs. We can't just expect them to go and read more papers. Humanly impossible, right? So we are building a tool called OncoBrain, which is the world's first AI oncologist that brings guideline-concordant care to the point of care, to that relationship between the patient and the provider, right? So every single provider is able to provide guideline-concordant care to every single patient that they see without exception. What we think that that's going to do is that's going to revolutionize and match where we are in time and history for oncology, right? Today, if we can make sure that every single patient can get guideline-concordant care, we can potentially end cancer as a death sentence. And that's what we're working on.
I love that. That's the whole reason we're here, is ending cancer as a death sentence. So I guess for the average patient who's listening to this show right now, how do they start this journey? I mean, obviously, they may have a doctor, they may not have a doctor, but how do they go and ask their doctor about guidelines or what guidelines? You don't want to challenge them because everybody's in a different sphere and has access to different stuff. But to your point, the odds are they're probably behind in some capacity. Yeah. What's a good advice for a patient?
So as of today, without any of the huge, crazy innovations that are available, right? Like I'll just talk about current state, right? If one of my family members got cancer, what do I do?
Yes.
Right? Okay. Here's your playbook.
Yeah, love this.
Okay. So first of all, you will try to get into depending on how you sort of discovered your cancer, it's either in the emergency room or your primary care doctor picked it up or whatever it is, you will always try to get to the best specialist you can within your reach. Right. It doesn't matter where you are in the country. There's probably someone around you that's an NCI designated cancer center. You go there, right? That's statistically significantly better clinical outcomes. Excellent. End of story. Once you get your diagnosis and your initial treatment, you always get a second opinion. Okay. Oncology is one of the only fields where this will actually create a 40 to 50% difference in your treatment outcomes, right? So you always get a second opinion. There are a lot of virtual second opinion services available through your employer now, through your payer. Figure it out. Most of the times it's free for patients, right? But they don't take advantage of it. So, and that's criminal. So get to the nearest NCI designated cancer center, then get a second opinion, follow the second opinion through, right? And then always think about what options do you have, both from a treatment perspective and a clinical trials perspective. There's always clinical trials going on that are really testing the next sort of frontier of treatments, and our treatments are just getting significantly better. And then the last thing I'll say is, because of the amount of precision available today, make sure that you have access to every single one of the most advanced testing available, radiology, genetics, et cetera, because that'll just give your oncologist a little bit more to play with in terms of how to decide your treatment. If you do those, I think, to me, pretty basic steps, you're on the right track, right? Yeah. And then comes the question of treatment decision making and how much you're able to tolerate in terms of procedures versus toxicities, et cetera. Those are things that are so difficult to deal with in the moment. I would say your last thing that you would do for yourself and would be a game changer would be to get a patient advocate. They're about $300 a month. They are fully reimbursable. You have a little bit of a copay, but the way they work with you and the way they help you think through your process in your decision making is magical. And even as a physician, don't think that way. So I would say every cancer patient should get themselves a patient advocate.
That's fantastic advice. And actually driving up here, thankfully I live within 30 miles of Moffitt and coming up here, I thought how fortunate I am to have access to you guys and the relationships that I have. If I ever had cancer, how blessed. So I'm glad you just gave that information. That's a fantastic best practice.
And if you're a first degree connection to us, call us.
Absolutely. Or text. Yes, absolutely. We'll do. So now shifting gears a little bit, specifically around CancerX, what are your goals for CancerX and what do you hope to accomplish here in 2026 alone?
Yeah. So CancerX was created with the vision that we wanted to make sure that we are equalizing access through digital innovation, right? And the problem I spoke about first, which is, how do we make sure that every incredible innovation is available to every single patient? It was part of a moonshot thinking, and when we started, we always thought it was going to be really difficult. And we set ourselves a goal that we wanted to reduce cancer mortality by 50% by 2047. Yeah. It's a big goal.
Absolutely.
And we think that we're going to get to that goal by making sure that patients get access to the right treatments at every single point without exception, right? The way we get there is through the use of digital and AI. And now, if you think about that entire roadmap, the place where everything is broken is it's really, really hard to get new innovations into old systems that are working the way they were working in the 1970s, and they have no incentive to change, right? So the goal for CancerX is to make sure that we become the national infrastructure to scale digital oncology. That's what we are, right? And so what we are going to do is we're going to build the building blocks of this infrastructure. We're already doing a lot of that. You'll see that in the next 2 days. Yep. And what we're also doing is we're making sure that now, we're matching unmet needs with really good ideas that are available in the market. With startup companies, scaled companies, whatever, we test them out, we prove that they work, and once they prove, we want to become the infrastructure that helps scale them to the next 100, 200 organizations. If I keep doing this every single year, and we do this for the next 20 years, we're going to have a couple thousand technologies scaled
Amen.
across cancer, and that's the impact that CancerX is going to create in the world.
I love that. How many people are involved in CancerX today from organizations?
Yeah, so about 150 to 180 organizations are involved right
Globally?
now. Globally.
Yep.
A good amount, about 80% of that is in the US.
Yep.
Right? And we're fortunate to have representation across payers, providers, pharma companies, startups, venture capital, private equity, banks, right? So we have a lot of the ecosystem really sort of represented. And the magic happens in the intersection of these, right? Which is where we see a lot of stuff happening. So peers working with providers and startups, or pharma working with a provider and a VC. Those kinds of relationships are where a lot of the magic is happening, and we think that that's the power why we think we can help with this infrastructure problem.
I love it. And this conversation initially came together. You, me, and Dr. Parikh were sitting actually HLTH in 2025, just last fall. And I believe, and we'll talk about this in a follow-on segment about, we have the ability to cure cancer. So even with the things that you're talking about, or create it more as a chronic condition. We're going to talk, more about that coming up. But I'm very excited about, what you just said is phenomenal, and then also the opportunity in the land, the advancements we're making. So here in the last question, looking into the proverbial crystal ball, what strategy, capability, or shift must CancerX be ready to navigate in the next 2 to 3 years from now to meaningfully accelerate progress?
We're sitting in a very fast-changing world today, and there's a few tech forces that are shaping what the next few years of the world are going to look like, and robotics, AI, artificial intelligence, all these other forces are coming to play. What I would say is that healthcare has typically been shielded from any of these tech bubbles because we just don't care, and we've looked the same we've looked in the last 50 years. Right. But I think this time is different, right? And I've been in healthcare now for 25 years, and I feel the difference this time, right? This time we're not going to be untouched. So what do we, as CancerX, need to do to make sure that we're shifting oncology in the right direction in this move so that we really benefit from it and we don't struggle under the weight of what this is going to do to us, right?
Excellent.
And so what does that mean? That means that, how are we helping organizations transform? How are we helping organizations keep up? How are we helping organizations govern? How are we helping organizations adopt it no matter what? Because at this, in the 12 minutes that we're having this conversation, 12 more people died of cancer. So we can't stop, right? We need to make sure that adoption is happening, but for all the fears that we have and all the things that it's going to disrupt, let's figure out a way to help people through that so that we still can innovate and we can still get the right treatments in the hands of patients.
I love it. Dr. Jethwani, thank you so much. Will I see you at HL or Vive coming up, or HIMSS?
I will be there. Vive
in LA. Awesome. Fantastic. Thank you, my friend, and thank you for hosting this, allowing us to come here with the show. We'll be here for the next couple of days. We've got a lot of great sessions. But what you're doing is applauded, globally, but obviously throughout our community. And this was a blessed opportunity to go up and do this. So thank you so much again.
I'm so thrilled that we got you here, and so thrilled that we can co-brand this.
You got it. And we're just starting this series. We're gonna have some good fun with it over this year.
Awesome.
So, thank you.
Thank you, sir.
Appreciate it.